Yeah, it's too late. I just love that. Sorry. Yeah.
Dead easy.
Give it a shot.
I'm going to try and speak. I hope that I won't be too rubbish at this, because I'm having a bit of a crisis and have kind of this week had to face the fact that I might end up in the Cavell Centre, and kind of the kind of issues that I've been thinking about is the fact that I have a wonderful partner, but he has chronic depression himself, and he works shifts, and you know, the kind of, if he would try to support me, up in the Cavell Centre, it would be a total nightmare for him to do that, work shifts and not get depressed. My own family situation is that my parents are very elderly, live in Norfolk, and my dad, he has had psychotic depression, and my mum is not very well, and it would just be such a struggle for them to kind of get to see me, and they support me as much as they can, but it's really, really hard for older people, to get to see loved ones all that distance. And as for my wonderful friends, that many of whom I have met during my time on Acer, everybody's got their own health to think about and their own, mental health conditions to think about. And that journey from here to the Cavell Centre, having made it once to see one of my really close friends, it was 50 minutes, and then it was a really kind of exhausting visit, because psychiatric wards are always quite stressful, and I actually found the Cavell Centre quite stressful because of its massive environment. The kind of room was so big, and there was a telly going at one end, and there was a radio going at the other end. There was the staff office in the middle overseeing everything, whereas on Acer you've got I think it's called a domestic setup, and the room, it's got rooms, and it's kind of, you can find private places. You're still cared for and supported. I think I'm right in saying that they have never lost a patient on Acer except for physical reasons, and there have been a couple of tragedies that have been physical deaths, but they always manage to look after people in a really supportive, caring way. And I found the Cavell Centre very stressful, and I was actually quite well on the day that I visited my friend, and and then it was coming home again, and my medication makes me very tired. So it was kind of, by the time I got home, I was knackered and thinking, I really want to see my dear friend again very soon, but I wasn't able to. And I think that was very sad, because she ended up having bugger all visitors, because her family live in Bishop Stortford and Saffron Walden. She just ended up stuck up there with not a lot going on, and I just think that is so untherapeutic, and I just think it is an utter tragedy that we have got a closed ward. And inside that ward, I don't know how many people have been in there, but it is a nice, lovely, homely environment. There's a beautiful garden, and you could do a bit of renovation, but there seems to be the money to make a new Lucille Van Geest ward up at, they're going to rebuild the Lucille Van Geest ward up at the Cavell Centre. There seems to be the money for that, so why, can't we just have a bit more, some renovation on Acer and just sort it out, I think that's probably all I've got to say today, but except for the fact that it's been amazing how the campaign has grown from just kind of disgruntled talking about it, when there was rumour control going on, and we were just hearing that it was going to shut, and then suddenly it was shut, and the way, everybody's kind of come in, and I just think it's been really exciting how that's happened, and I'm really grateful for that. And also the fact that this whole campaign has raised awareness about mental health issues, because, you know, I've actually dreamed of being at a mental health demo, you know, kind of all my life really, and apart from stuff that I did with Mad Pride way back in about the late 90s, you know, it's not happened. And I think a lot of awareness has been raised about mental health in this area, and I'm starting to feel that I don't have to kind of hide my condition in fear that somebody is going to come and persecute me, but you know, that I can actually talk about it, that we can be here, we can stand here, and we can say, yeah, okay, we've got an illness, but so what? You know, you deal with it. It's not our problem. If you've got a problem with mental health, well, you know, you find a way to deal with that. So I'm sorry that was rambly and probably lost the plot in the middle, but thank you all for being here, and just thank you.
Cheers for Cheryl.
Cheers for Cheryl, yes.
Hip, hip.
Gets the side of
Yeah.
Thank you. And I'd say Cheryl, again, I think speaks for everybody as to why this is a much needed facility here.
Thank you. I'm St Ives Town Councillor, and I'd just like to say that what really shocked me about all of this was that our medical practitioners, even our GPs, were conspiring with the health service, with the bureaucrats, to close Acer Ward, and to me that's totally unacceptable. I mean, making all the patients, their carers, travel all that way, even think about getting to Peterborough, it's just totally disgraceful. And I hope that this campaign causes the doctors, the GPs to think again, that it shames them into thinking again. Thank you.
Thank you.
Thank you.
Dear friends, I'll be very short. I'm a medic by profession, and in 35 years I am a carer of my partner who has bipolar. We have visited many countries and have experience in different mental health care systems. And I was charmed with Acer, and Acer actually saved my wife's life. I often hear in the news, read in the newspaper, that Acer will be Hinchingbrooke will be the 10 best among the 10 best hospitals of the country. But how can you make the hospital 10 best if you are hacking department after department and closing down services?
Absolutely.
Thank you.
Yeah.
Well said. Right, I noticed that the man down there with his camera is still about, so I think we ought to make a little bit of noise and give him something on his film.